the one and only, he whose legacy is spoken about in whispers throughout the regions, both in this dimension as well as others. The one and only George Crawford, MD, from the legendary Olympic class of 1996
Olympic
of
class.
Morehouse College.
Olympic class.
What it do, boy?
Man, man, man. It is good to see you. You been all right?
I've been good, man. I've been good, man. Just the same old ones and twos. How have you been, bro?
Working, man. Healthcare is healthcare right now, so it's healthcare. But it's fun. I'm enjoying it. I'm enjoying it. I think.
Bro, hey man, honestly, man, thank you for taking the time out on your Saturday, man, to hang with us here on People Street, man. I know you have a whole lot of stuff you could be doing. Today we have my classmate from the illustrious class of 1996 at Morehouse College, that beacon on the red clay hill in Georgia, George Crawford, who is the definition of a multi hyphenate. Can you tell us, George, who are you, bro? Who is George Crawford?
Uh, I'll start at the top. First thing I'd say is I'm a dad with four kids, and then from there I'm a surgeon. Then I have all this other stuff that I do on the side. Man of God, got to put that out there.
Indeed.
And inventor, and somebody with probably too many hobbies. Between my hobbies and my kids, I probably will be working till I'm 109, like my grandmother did. So
Oh, wow. She's lived till she was 109?
yeah, man. She passed in November, and she was about 6 months short of 110.
Oh my God,
Yeah,
dude. Dude, you're
she
so blessed to have had her that long, bro.
absolutely. It's kind of weird to be 50 years old when other people are losing their parents, and my
Hmm.
grandmother was still around. So, and she played a pivotal role in my life. So yeah, so it was a blessing.
Was she sharp?
She was up until 100 and maybe six, probably, and then that's when
Hmm.
we started to see the decline.
Hmm.
But she was always a funny one. I would actually feature her every once in a while live on my Instagram,
Oh yeah.
and I'd ask her. I said, I explained ratings to her, and I said, Gigi, how would you rate, you know, 5 stars, getting 106? She was like 0 out of 5, would not recommend. you know. So, but no, it was a blessing to have her around, and we enjoyed it. And I think, up until that last 5 years, she enjoyed us. So it was a blessing.
Did you ever ask her what the secret was to her longevity?
Okay, listen, this does not work for everybody, but she said, just stay single and you'll live forever.
That's what she said.
Yeah. So yeah, I know. That's why I prefaced it. I'm like, this is not, this is not advice. So don't come looking. Wives, husbands, don't come looking for me. But she. My grandfather died when she was 32,
Oh.
and
Ooh.
my father was an only child. So you know, my grandma, she was living life after that, and she was like, I did exactly what I wanted to do, enjoyed it. If I wanted to do it, I did it. If I don't, I don't. She said, I just lived a happy life with no stress. I was like, okay.
Man, listen, dude. I want to get into the weeds on that, George. Because for those that are just meeting George Crawford, George is a very humble guy, but George is a fantastic surgeon, and George has always been tight, even since we were in college. But you come from a family of intellectuals, and there's a common theme, George. I got a partner that I went to med school with that I'm really close with. That's an orthopod down here, and invariably we always end up talking about, what were the social ingredients that went into us getting to where we are today.
Right.
You know what I mean? And without a doubt, family,
Yes.
strong family, it is has been seems to me one of the primary, if not the primary determinant. George's brother is also a plastic surgeon. He also, I actually, took chemistry with his brother. I don't know if you knew that or not, dude, but
I
I,
didn't know that.
yeah, yeah. Marcus and I, when I didn't decide to go into medicine until sophomore year, so
Okay.
obviously I was behind cycle. You
Right.
know what I mean?
Right.
So I took those basic classes with the younger cats. So I took a couple of classes with Marcus. But statistically, for both of y'all to end up being surgeons, in America, just worldwide, to have two siblings that are physicians is exceedingly small,
Right.
regardless of ethnicity, regardless of socioeconomic class.
Right.
And it's two of y'all that I know of out of one family.
Right.
How did that happen, bro?
So, okay, listen, this is not advice for everybody. So I just I'm gonna go ahead and preface that again, like my last statement. So my I grew up on a farm, and my parents had a couple of rental houses, and every day when I got home from school, I had to go cut grass during the summer. Or with summer break, I had to go do something with the cows. And, my parents kind of made a deal. They said, hey, we will support you to while you're in school. And when you get out of school, you're on your own. Or you can sit up here and take care of these cows, chickens, and goats and cut grass. And my brother, my sister, and I kind of said, not doing that long term. So we
Right.
looked for the longest schooling thing we could come up with, and my brother and I were both like, "Man, let's go to medical school." And my dad was a dentist, so we kind of already had that healthcare um, kind of turn anyway. But yeah, my sister got a PhD. My
Oh,
brother's a plastic surgeon, and I'm a general surgeon. So if you tell your kids the options and lay them out there, and also I think instill hard work.
mm-hmm.
That's the one thing that I've learned. And I think Harvard did a paper about kids and chores.
Mm-hmm.
They're more likely to be successful if they have a lot of chores when they're children because they get used to it. So I
Mm.
think building that desire to that it's not a desire. What happens is work is a pain in the butt when you begin, but somewhere in the middle you start to enjoy it and you kind of appreciate the fact that you're doing something and getting something out of it.
Yeah.
And I think my parents just kind of instilled that in us early.
Mm-hmm.
And that combined with you do pretty well financially in healthcare, and it allows you to open up a lot of doors um, from that standpoint. But I will tell you a secret. I technically kind of didn't know I wanted to do medical school until maybe my senior year
Mm-hmm.
at Morehouse,
Mm-hmm.
and when I was applying through the process, and part of it was because my brother was like, "I'm going to Baylor College of Medicine." I said, "Oh well, I'll apply." And my homeboy Moses, he was like, "Well, I'm going to medical school," and I
Mm-hmm.
was like, "Well, it sounds like it's
Mm-hmm.
long school. I don't have to go work on the farm anymore. I'll
Yeah.
do it." So it just kind of ended up. I kind of followed other successful people, like Kelvin Moses, urologist at
Mm-hmm.
Vanderbilt, Marcus, and then Eric Tate came through. It's just a lot of brothers that came through, so we kind of got on this road together and went there.
What's your sister's PhD in?
She has a PhD in epidemiology from Harvard.
Wow, dude, that's crazy. What does she do?
So right now she works for startups. She does. I'll be honest. She has one of those jobs that I barely
I
understand.
understand.
I
Yeah.
just get a text every once in a while. Hey, I'm presenting in front of the UN, or hey, I'm doing this conference here, or hey, I'm doing this,
Yeah.
and I'm like, okay, you know.
Yeah.
But she's paying the bills with a good degree, so I can't complain.
Yeah. You famously come out of the chemistry department.
Absolutely.
Um, the chemistry department at Morehouse College was a chemistry is tough anywhere. It was especially tough at Morehouse, and George excelled at chemistry, such that people knew outside of the department that George was kicking tail in chemistry. Um, what was the school system like? Where you first of all, where did you grow up, and what was the school system like, George?
So I went to Aiken High School in Aiken, South Carolina. It was a regular old 4A public school in rural South Carolina.
Mm-hmm.
Nothing special. I kind of goofed around in high school a good bit, but I had a great science teacher and a great math teacher. Miss Andrews was the chemistry teacher, and I just fell in love with it. And then math and science, I think, just kind of came natural to me. I think my best grades definitely were math and science, but I didn't like reading and doing all that other stuff, history. Um, so yeah, nothing special. No prep school. No summers. At one of the Duke University programs or anything like that. Just
Hmm.
public high school.
Miss Andrews, man. Tell us about Miss Andrews, man. Was Miss Andrews a sister?
No, no. Miss Andrews was an older white lady that smoked about a pack a day.
Okay, Miss
Um,
Andrews. What was she
yeah,
smoking? Was she smoking
she, you know,
Newports?
but here I'll tell you the thing. The only reason I remember her name was I was in her class sophomore year, and she was one of those weird ladies. She had everybody sit in alphabetical order, so there was no favoritisms, none of that. You just walked in, sat down, and the only thing you could do was the smart. She ranked your laboratory group by your grade. So I was at
Oh,
the first table or the second table versus you at the very end.
yeah,
I don't think you can get away with that right now.
yeah.
But one day I was like, Miss Andrews, you know, I keep seeing a pattern. And she looks at me and she's like, what? She said, I'm like, there's a pattern to stuff you do and the test and all this stuff. And she said, catch me outside and I'll tell you. It's like,
Okay,
okay.
okay.
So I was walking around one day and she was outside smoking. And I walked up to her and she says, I teach the same thing every year. I'm like, what? She's like, I have a set book. I'll show it to you. And on day one, I teach this. Day two, I teach this. Day three, I teach this. She said, I've been teaching so long that I've gotten it down to a science.
Mm,
Um,
no pun
and
intended.
she said, I don't have to think about it. She said, I don't have to think what I put on the board. I'll just look in my book and say, today's day five. And I know the ninth graders get this, the 10th graders, 11th graders, 12th graders get this. And I'm
Yes.
like, wait a minute. Did she say hustle? Sure, she didn't say hustle.
She said hustle.
She said hustle. So I was just kind of like, from that standpoint, I think I went into education realizing that, part of it was a hustle. It's like anything in life. You got to understand the hustle. And when you understand the hustle or you understand the game,
Mm-hmm.
you understand the rules of it, it makes it easier and you now know how to play.
Mm-hmm.
Um, so Ms. Andrews was always, she would just sit up there. It's almost like she could write up on the board without looking because she just had
Mm.
done it for so long.
Mm-hmm.
So I think she kind of put me on that right path of understanding that yes, it's a body of language. I mean, body of knowledge in education, but it's also a game. You got to be
Mm-hmm.
able to understand the game. And once you understand the game in anything,
Mm-hmm.
surgery, medicine, chemistry,
Mm-hmm.
whatever, business, inventing, all of that stuff. Once you understand the rules and know how to play, get in the ring.
God bless Miss Andrews,
I
man. Is
know.
Miss Andrews still with us? Do you know?
No, man, no, 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 no. I
She went
think
on home.
she was 60 when I graduated from high school, and that was back in 92.
Mm-hmm. Oh
So yeah,
wow. Yeah, yeah. So she's home. But bless her anyway, man. For not only doing some good teaching, man, but having her pedagogy down
right.
to a science.
Yes.
You know what I mean?
Yeah.
And being able to transmit that to her students, man. Were you a well-rounded student in high school?
Nah, man, we probably want to skip high school. High school was rough for me. I
Oh, it was.
oh dog, high school was rough. I I had a rough start in high school. So once I got past the freshman year, I played. I was in the band, played football.
What
So
you
I did a
play in
little bit of everything.
what you play in the
Um,
band, George?
I was a percussionist.
Oh, okay, right on.
Yeah, and my parents started me playing piano when I was very young, so I could read music. Still play a little bit of piano. My mom was that girl that grew up in rural North Carolina that sang and played the piano in church, and she, continued to play, until she probably had kids. We had a piano in the house all the time, so it kind of was always around music.
Mm-hmm.
Um, but my parents made sure that we were well-rounded, kind of outside of the traditional model.
Mm-hmm.
Perfect example is like my brother and I were registered boat captains in South Carolina when we were like 18 and 25.
For
We had
real?
motorcycle licenses. I think we did, we were, still are, observers for the International Game Fishing Association for marlin and sailfish tournaments. So it's just kind of, my parents were they try anything. They were like, hey, let's go see if we like it. So some of the stuff we did, some of the stuff we didn't. So we were always exposed to just everything.
No limits.
None,
Your
none, none,
parent. I
none.
mean, I see a pattern
Right,
emerging.
right.
Your parents instilled in y'all very early, no limits.
Yes,
You know
yes,
what I'm saying,
yes,
George?
yes.
Because I'm from Chattanooga, Tennessee, man,
Okay.
and you know how it is, man. A lot of times, the people that we're around, their social construct limits them from the get go, man.
Correct.
Because like yourself, my mom, my first of all, my mom played piano all through
Okay.
high school.
Okay.
She played in church. You know what I mean?
Yeah.
But she encouraged us not only to play piano, but to do what, like, I played clarinet.
Okay.
We did
You played
every
clarinet.
I played B flat clarinet, bruh. And it wasn't my favorite, but I
Right.
wanted to try it, and she didn't discourage me from that.
Correct.
You know
Correct.
what I'm
Correct.
saying?
Yeah. Absolutely. Absolutely.
You know what I'm saying? And that's what I have told my children. Try it.
Right.
You know what I mean? And if you
Right.
don't like it, fair play.
Correct.
But you
Correct.
may love it. You know
Yes.
what I mean?
Yes.
And even if you don't, the immersion in the activity is going to make you a richer person. You know
Yes.
what I'm
Yes.
saying?
Yes.
So I totally I love how your parents and their approach to parenting is, man, because our kids and kids at large need that, man. You know what I
Yes.
mean? Because there's not just a one track way to approach childhood and being exposed to things.
Correct. Correct.
Um, so high school. How did you end up coming to Morehouse, man?
So I am a second generation. My dad graduated from Morehouse in '63,
Okay.
and he graduated when he was 18.
What?
Yeah, he went 15. He started 15, graduated when he was 18. My dad is
Bad boy.
my dad. And he was an oceanographer for 10 years for the Department of Defense, and then after that, he went to dental school in Augusta, Georgia. So, he kind of my grandmother was a teacher. So, around that time, she was like, Morehouse takes boys and turns them into men. So
There
I
you
will
go.
give my son to Morehouse so that they can make him a man. And I think for her, part of it was Morehouse was founded in Augusta, Georgia, and so there is that presence there. Plus, my dad, his dad was not around, so she kind of leaned on the community. And in Augusta, Georgia, there's a lot of brothers that went to Morehouse College, so it was just kind of that. And then it's like, even though I have a bunch of play uncles. All of those jokers went to Morehouse College, so
Right.
I probably would not have been able to go home for Christmas or any holidays after high school if I didn't end up at Morehouse. So part of it was forced upon me. I didn't choose it, but couldn't refuse it.
There
And
you go. Up to you to use it.
yeah, that's right. That's right.
You know what I'm
So
saying?
that's how we ended up there. My brother went to Morehouse. My sister went to Spelman. My son Ryan, he just got into Morehouse. He'll be there. Ethan is like, I'm going to Morehouse too. I think Ethan will probably, even though he's a sophomore this year. I think when Ryan starts at Morehouse, Ethan probably will start at Morehouse as well because he's
Okay.
like, I'm going to hang out the whole weekend. And
Yeah.
I do dual enrollment. I'm like, dude, slow down. Just
Yeah.
you gonna get there. So,
Dude, that's a beautiful
and
thing,
then my
George.
oldest daughter, she transferred. She and I had she didn't. I told her she needed to go to Spelman. She wanted to go someplace else per her mom. She transferred in on her junior year, so she finished up at Spelman as well. And she's a dentist. She's graduating from Tufts in a couple weeks.
Congrats, George,
Yeah,
man.
yeah,
Boy, listen, man. Man, I'm gonna be calling you, man. You know what I'm saying? Because I love what you're doing, man. Let me ask you this.
yeah.
So, for those that don't know, my roommate in college was also from South Carolina. He's gone. He was our classmate at Morehouse. Very special guy named DeQuincy Hence. He was a preacher and
Yes,
intellectual.
key.
Really big South Carolina guy.
Yes,
And he used to have tremendous respect for you, George. And I think that one of the conversations he had we had very early on was, I don't know if y'all met before y'all came to Morehouse or
Didn't met him
or
there. Met him, South. Like I said, South Carolina kind of always. We always, a couple of us, and we just kind of always knew each other. And yeah, I met him at Morehouse.
yeah, yeah, that's so crazy. And I remember us sitting around talking one day when I decided to go into. I think it may have been when I decided to go into medicine. I'm from the English department,
Right.
George.
I didn't know that.
Um, yeah, yeah. But I remember he was talking about you in chemistry, and I was like, yeah, man, because you used to tutor too, right?
I did. I
Yeah,
did.
yeah, yeah. I remember you used to tutor, and I was like, yeah, man, I'm gonna need some tutoring. He was like, man, you need to go holler at my boy George. Blase blah. George is nice with the chemistry, and I was like, okay. I said, well, we continued to talk, and he was like, yeah, man. He was like, I was talking to George, and I asked him. This is what he telling me. He was like, yeah, I asked him. I was like, man, why you like chemistry so much? And he said, this what he told me. You told him. He said, you said, man, I just got a romance with it. You know what I'm saying? And we 19 having this conversation. You know what I'm
Right.
saying?
Right.
So I'm like, I couldn't stand chemistry in high school, man. You know what I mean?
Right.
So what was it about chemistry? Like, why chemistry, George?
So
As a, you know what
it,
I mean?
yeah, it's the way my brain works more than anything. I think like even in healthcare or anything I do, I tell a story, and chemistry probably tells the purest story of any discipline. Physics sort of, but chemistry is based on the bonds that are created. How hydrogen, oxygen. You're looking at neutron and electrons, and it builds from there. So you
Mm-hmm.
again, kind of like Ms. Andrews, you have this core set of rules that you have to follow. Once you follow those rules, um, you grow from there. And chemistry is full of rules, Heisenberg uncertainty principle, stuff like that. That it
Mm-hmm.
just kind of was like, it made sense to me,
Mm-hmm.
and it's kind of even the way that I look at surgery now. When I do surgery, I look at, okay, these are the rules I got to play by. This is what I'm doing. Let's make it happen, and then that's how I go with it. Or even when I talk to patients, I'll tell you a secret. I probably cannot remember anybody's name. I'm always been bad with names. But if you say that, that's and once you kind of click me in, I'm like, oh yeah, you're the person that has 3 kids. You got a daughter that does this, that you like doing this, and you had your gallbladder out, and I did that. And people look at me, they're like, why? I'm like, because I just remember stories. It's like this little book, this little book, this little book, and it's just from chemistry. And, that spoke to me. Plus, Dr. Gore was in the math department.
Mm-hmm.
And I met
Mm-hmm.
that brother probably summer science, and I was like, he's a little too intense for me. So I think I was one class short of a math minor at Morehouse.
For real?
Yeah.
For for,
So
for
chemistry
those that
degree, because I just love math and chemistry, and they go hand in hand,
hand
like
in hand,
chemistry
yeah.
does. But Dr. Gore, I was like, ooh, and at that point, I was like, I'm trying to go to medical school. I don't want to mess up my GPA. I was doing pretty good by that time. So I just said I'll switch because I think I actually was a math and chemistry major in the beginning, and then just said I'll switch to the math minor. And then I said I just needed one class, but I was not going to take it to mess up my stuff. So
You know, just to digress a minute.
Mhm.
Um, at the time that we came through Morehouse,
Okay.
and I'm just speaking to kind of like the people watching this interview. George and I, we were born in essence, post civil rights movement. So we still had a lot of professors walking around campus that had been there through the 50s and the 60s
Yes.
that were legends of
Yeah.
Morehouse that built the reputation of Morehouse, particularly in the science department.
Yes.
In George's department, we had Dr. McBay,
Hmm.
who was a giant
Yes.
of chemistry. One of our math professors, Dr. Gore, was a legendary mathematician, and he was the type of cat. If you watch Different World, and Colonel Taylor,
Hmm.
Colonel War,
Right.
or Doctor War, whatever they called him. whose reputation preceded itself. George, can you please share with us an anecdote about Dr. Gore? I never took Dr. Gore, but I was scared to take Dr. Gore, and everybody was scared to take Dr. Gore. Can
So
you tell us an anecdote that illuminates his reputation?
yeah, I'll tell you two actually. So my best friend in the world, Kelvin Moses, he and I did summer science together. So that was like a pre-program before we started Morehouse, and he his name was Kelvin Moses, and Dr.
Moses.
Gore with his glasses, and you say something, he'd look over the glasses, and he'd look at you, and he would just say Moses, and he went on this biblical talk for I don't know, it was like 10 minutes about the math in the Bible, and from that point on, everybody knew Kelvin Moses on campus as Moses. It was just kind of just because of when somebody goes in on your name and mathematically breaks down the Bible and keeps calling you Moses for the next 15, 20 minutes in class, you just become Moses. But the other story I do remember that was pretty funny was he had these kids, these four Morehouse guys that were late to class one time. They had a test, and he was like, they were like,
Hmm.
"Hey, sorry, we had an issue with the car. The car broke down. We got a flat tire. Couldn't really make it to school on time. Can we retake the test?" And he said, "Okay." So he said, "But put them all in four separate rooms." And he looks at each one of them and says, "Which tire?"
Yes, that's it.
And I was
That
like,
that's the famous story, George.
"Yes."
George, was that a true story?
Yeah, so he said it was a true story. He said it was a little different, but he said, yeah, but the basis of it was true. But the other thing is it always sticks in my mind, and I always tell my kids, I'm like, listen, guys, always be honest, but if you're doing something you're not supposed to be, and you're trying to make up a story, or you're just doing anything, the devil is in the details. And that's what that story always taught me is that,
Ooh.
those guys would have gotten away with it if they had just said, hey, right front, right front. And it was just a
Yes.
detail because they did that first level of the hustle. And it's like you got to know the second and third. But Dr. Gore, you wouldn't have been able to get around. He might have asked what type of tire or who fixed it. He
Yeah.
would have come up with another question. But, again, the details.
That is the classic story, dude. That's the story I know.
Yes.
And that's the story that followed Dr. Gore around. Can you imagine, because back in the day, we used to do stuff like drive to Howard homecoming. You be late to class. Dr. Gore say which tire was flat. Y'all ain't talked about which tire.
Right. Exactly. Exactly. But now, I'm not worried about my kids because they will know which tire, who fixed it. We call AAA. Here's the
Yeah.
number.
Yeah, no doubt. No doubt. Take it. All right, take us to the present day, George. Why general surgery, bro?
So at the end of the day, I would describe myself as a pseudo artist. Um, and the thing that really drew me, two things that drew me to general surgery. One, well, actually, I'll go with three things. Three things. So one, and I'll put a small story. I did a way rotation at in medical school in Cancun. Worked in a small hospital there. Met a guy, Jose. I can't remember his last name, but he was a general surgeon that had trained at UCLA. And this was a small hospital. They had windows in the operating room. The patients had to wash their own dressings. And he had this patient come in, and she was hurting, had real bad pain. We next day took her to the operating room. She had a huge gallbladder infected. She was in the hospital for a week. She came back to see him probably 2 weeks. It was like right before, maybe 3 weeks later, right before I left. And is that a dog?
It's my puppy, man. This is Bogley.
I know.
Say hey to
Listen,
Dr. Crawford.
listen. Had I known we were bringing animals, I would have brought my turkey or my one of my chickens with me and brought them up on the thing. Um, but the but she came back and she was like, he was like, "How are you feeling?" She was like, "Feeling great. No more pain. I'm good." And he was like, "Okay, thank you." And I'm like, I had this look in my eye. He was like, He's like, he said, yeah, you got the bug. I said, what are you talking about? He said, in general surgery, we fix people. He said,
Mm,
everybody else in medicine, they come in, they have problems, you kind of fix it, you kind of take care of it. Because up in that point, I think I wanted to do family medicine or OB because that was the only real type of physician I was exposed to. And I
mm-hmm.
realized, wait a minute, this is like a one night stand of medicine. People come in with a problem, you fix it, and then you don't have to talk to them anymore.
Right,
Like,
right.
that's the core of general surgery. Appendix, gallbladder, colon cancer, breast cancer, skin lesions, whatever, lipomas. You cut them out, they're done. They don't have to deal with it anymore, especially if you do it right. So that ability to fix people that spoke to me. And then the nice part about general surgery is, especially laparoscopic surgery, which I kind of took a real big liking to, is that you kind of have this black box. People say, "Hey, I have this problem. You're going to go in and fix it," and I literally go inside, fix it, close them back up, and nobody knows what I did. They know that they feel better and their problem is solved, but it's kind of like creating a piece of artwork and then sealing it in a box that people can only see the outside. They don't actually see the beauty or the complexity of it. They don't know if this surgery was supposed to take 2 hours and we did it in 20 minutes or the reverse. They don't know if it was worse than we talked about and we got it fixed. At the end of the day, they kind of don't care. They're like, I'm better. That's all that counts. So that
Mm-hmm.
mystery of it, kind of I enjoyed. And then I really fell in love with it probably when I got into medical school and realized how behind general surgery was from a technology standpoint, and really, honestly, healthcare in general.
Mm.
But
What do you mean specifically, George?
so laparoscopic surgery was invented in the 80s, and it really didn't get up and running until around 92, 90, or in the 90s, maybe 95. So a lot of the stuff that we were doing in general surgery when I was in residency around 2000, we were still figuring out instruments. We didn't have good instruments to do some of the stuff that we do. One of the leaders in general surgery, C. Dan Smith, who taught me at Emory, and John Hunter, who's also at Emory at the same time, they would talk about we need these type of instruments. In order to do a fellowship in laparoscopic surgery, C. Dan Smith had to hop around and do micro fellowships just to kind of gather the data.
Oh,
So I
wow.
kind of trained during general surgery when laparoscopic surgery was in its infancy, and there were a lot of instruments that they needed that they didn't have. There were a lot of processes that hadn't been developed just because it was new and the nature of healthcare at that time. Um, so it left me a opportunity to say, okay, not only do I like the surgery, I like the mystery of it, I like fixing people, but there's also a lot of room for improvement. And that's kind of where I took my inventive nature and kind of went into surgery with it in healthcare.
For those that don't know, let's get into the weeds a little bit. George is talking about laparoscopic surgery, and what he means by that is, the traditional surgical approach, for thousands of years, has been to take a sharp instrument and cut through skin and approach problem solving from that way. But laparoscopy, these surgeons have the capability to insert what they call a trocar into the abdomen and what they call insufflate, which is to insert a gas into the cavity of the abdomen, which makes it, which would separate, which gives him space. I guess that's the best way I can describe it to view the organs, and also simultaneously, with both hands, which is where the artistry comes in at. You have to be very dexterous. Your depth perception, your hand-eye coordination, has to be great, to actually approach a lot of these surgical problems through this through this approach, and while looking at a camera, with making a very, very small incision, which decreases the amount of post-operative morbidity, meaning complications that don't cause death, and mortality, which is death. And it revolutionized surgery But people often ask me, George, from the anesthesia perspective, like, "Well, what are y'all back there doing?" But in particular with laparoscopic surgery, that laparoscopic surgery has its own set of attendant issues that you have to
Yes.
deal with.
Yes.
Also you have to think about bradycardia during these issues when the vagus nerve, is stimulated upon insufflation. Increased airway pressures when you're in Trendelenburg, things of that nature. So people like George are artistes and go in and are able to solve these problems while hopefully decreasing the possibility of these extra long hospital stays that are not only super expensive but have attendant risks just from being in the hospital itself, because we all know that being in the hospital for a period of time has its own risks as well, dude. So if you have children out there that are interested in what George is doing, look at his page. He posts so many things. So many routine and non-routine types of procedures that are super duper interesting. And if you're interested from the anesthesia side, anesthesia for all of these different disciplines is super interesting as well. And it's like a symphony because there needs to be communication between the surgeon and anesthesia. Which is a beautiful thing too, to be in concert with somebody else. You also are a bariatric surgeon. Is that
Yeah.
correct, George?
Yeah.
What does
Yeah.
that mean?
So that's weight loss surgery. Right now, the dominant procedure in the United States is a sleeve gastrectomy. So we make a stomach about the size of a banana, more or less, so you eat less. We're not doing as much as we used to now because the GLP-1, the Ozempics, Wegovy, all of those medications, and some of the older procedures are coming back, like duodenal switches, just because if you wanted to lose 10, 15, 20 pounds, you could do it. If you want to lose 50 or 100 pounds, before you had to look at surgery. Diets themselves were successful about 10% of the time, versus surgery was successful about 60 to 70% of the time. So for long-term weight loss is a better option. And we were doing that up until GLP-1s. And here's the funny part is as a surgeon, I'm like, GLP-1 versus surgery, do the GLP-1. I hate to say it, but less risk. Surgery has risk. No
Hmm.
matter who you are, there's a possibility that you have a problem. So if you have the ability to lose the weight without doing it, okay, I think that's reasonable. But what's happened though is with that, we've seen, one third of the patients that we would do, that one half that were just trying to lose 50, 60 pounds, they now do that with medication. So the patients that we're left with in the bariatric world are the people that need to lose 150 pounds, 200 pounds, people that need staged procedures. So it's becoming back from a generalist thing to a specialty thing. But at the end of the day, with one third of our population being overweight, something needs to be done.
George, can you explain to people that don't know what does staged procedure mean?
So, so the average person is probably going to lose 100 up to anywhere from 50 to 100 at the high end, 150 pounds with a sleeve gastrectomy. 150 would be someone that's you know putting in the work, eating the right things, doing lifestyle changes, but average 75 to 100 pounds. If you are 250 pounds overweight, your risks are really high even during surgery. So a lot of times what we'll have to do is we'll do a sleeve gastrectomy first, and then you'll lose 100 pounds. So now your risk from the anesthesia, your risk from complications, your risk from surgery are a little lower. So then we sometimes have to go back and convert them to a gastric bypass or something called a SATI, kind of rerouting the intestine so that you have a malabsorption component. So when we talk about staged procedures, we're really talking about doing two so you can lose 250 to 300 pounds in a safe manner.
Okay. So for those that don't know, what do you mean a malabsorption component, George?
So a sleeve gastrectomy, all we're doing is make your stomach smaller, so you eat less. You get full quicker. When you start doing stuff like duodenal switches, when you start doing stuff like SATIs, when you start doing gastric bypasses, what you're doing is rerouting the way that the food goes into your intestine and when it comes out so that you have a shorter time to digest that food. So if you say you have 20 feet of small intestine, if we bypass 10 feet of it, you digest and absorb half of the calories that you did before just because of that time. Now, we do know the body is pretty slick. It's very slick. It does a lot of,
Hmm.
it knows what's happening and can figure it out. And we know that a lot of those malabsorption surgeries, after about a year or two, the body kind of figures it out and says, hey, we just need to become more efficient in that last 6 feet, 10 feet of digestion to be able to get those calories. So perfect examples of bypass. That's why you see patients, get a bypass, they lose, you know, 20 pounds the first month and then just trickle down and then eventually settle out around 7 to 10 pounds. But what happens is after 2 years, about 40 to 50% of them start to gain the weight back. And it's just because they haven't changed their lifestyle and their body has figured out the trick. So now it's more efficient in absorbing calories. So even though you've bypassed part of the stomach, it's absorbing those calories again.
Pros and cons of semaglutide inhibitors, George.
Dog. Okay. You want to go
I,
there.
I
All
mean,
right. So here's the thing.
from the layman from the layman perspective, because that's become as dog. I mean, like man,
No, 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 no. No, yeah. So
I mean
yeah. No,
80.
I got
I
you.
mean,
I got
like
you.
70% of my patients are on
Right.
it, man. You know
So
what I mean?
the positive.
Hey George, you're
Yes.
glitching. You're
Hey,
glitching a little.
do y'all delay them like 1 week or 2 week,
We delay
2 weeks
7. You
before
have to be off seven
before they can
days,
have
bro.
anesthesia?
You have to be off 7 days in my center. Um, you glitching a little bit, George.
Oh,
On my end, and I can fix
are
this in
you there?
post. I just want to know is there anything that changed in the
Okay.
last minute or so?
Okay.
Do you see it? Oh, but keep going, bro. I can't hear you anymore.
Yeah. I think my battery is we're eating up all the juice.
Do you have you connected to a
So
plug or?
the I haven't changed anything. Um, can you hear me now?
I can hear you, but you're blurred on this end. Um, and but you know what? This the beautiful thing about Riverside, and again, I'm gonna fix this in post, is that even if it's blurred on this
I
end,
am.
it'll fix it. It'll
Give
fix it in post.
me 1 second. Let me see if I can change one thing.
Okay.
Yeah, I think the connection. Uh oh. Okay. Oh yeah, I see what's going on. It's uploaded the maximum amount of so it's delaying it because of that.
You wanna back
I
out of the
think it's
room and
probably
come
because
back
my
in.
camera quality is kind of high.
Well,
Um,
let's back out of the room and just
but
come back in. I mean that should reset. Your device died.